So feeding, again, you can do oral feeding if you need to, but again, they need to be normothermic, because if they're not, their gut is not moving correctly, and they're not going to be able to suckle correctly if they're cold. But if they are normothermic and they are suckling, go ahead and you can bottle feed them with any milk replacer that's commercial, and go ahead and use what the manufacturer says for that. And if you want more information, if you go to the Maddie's Institute website, they had a really, really nice video on like how to bottle feed a normal neonate. So if you've never done it before, or you just want to make sure you're doing it correctly, I would recommend that video because it's very, very helpful for just normal feeding with a bottle. Now, if you have somebody who's sick enough that they can't feed with the bottle, we're going to do some actual tube feeding. So when you break into tube feeding, we worry about overfeeding these guys, which is one big thing. And so we need to be very careful with that. And I'll talk about like more numbers with that. And the types of tubes we're limited to are like orogastric or nasogastric maybe in a neonate, depending on their size. So we have a little poll question about that.
Yes. Which type of tube feeding are you comfortable doing? Orogastric, nasogastric, both A and B, or neither A and B? So our veterinarian friends are going to answer this. Orogastric, nasogastric, both A and B, or neither A and B. And we'll go on ahead and look at our results.
Okay. Great. Okay, so orogastric tube. So it looks like at least half of the audience are comfortable with that, so that's great. And some people have done nasogastric and orogastric too, which is great. Good. But it looks like some people haven't tried either, so we'll talk about that and make sure everyone's on the same page. So good, good. Okay, so the orogastric tube is the one that a lot of folks who breed kittens or puppies are very comfortable doing, and that's where you're going to place a tube through their mouth into their stomach. Anybody who took large animal medicine in vet school, we had to do this in cows all the time. So this is where I first did it, was in a cow. So typically you're going to use a 5 French red rubber tube. You could use one that's slightly larger, but in a neonatal kitten you're probably limited to the 5 French. And just like the picture shows, you're going to basically measure from the last rib to their mouth. And the rostral part of their mouth, so where the lip kind of ends. And you're going to mark on the tube where that location is, and that's how far in that you're going to go. So typically you're going to hold the little kitten in a sternal position, flex the head forward, and just kind of move the tube along the roof of the mouth, and then just kind of keep feeding it. And most of the time, 9.9 times out of 10, it'll go ahead and drop right into the esophagus and go straight into the stomach. So you'll often hear the kitten meowing while you're feeding them. That's good, because that means the trachea is not occluded by the tube. And they shouldn't be coughing. And you can do just a little test injection of water. Make sure you give enough water that it gets through the tube. So you're probably looking at least 1 ml to 1.5 ml of water, because it has to go all the way through the tube and then get into wherever the tube is. They shouldn't cough. They shouldn't have any problems with it. So if you're feeding them, you give them a little bit of water. They don't cough. They don't gag. They're continuing to cry. You're in business, and you're in the stomach, and you can go ahead and feed them your amount of food. When you remove the tube, you always kink it, because you don't want any additional food that's left inside the tube to drop out of the tube as you're drawing it out and end up in the lungs and cause aspiration. So just remember that. These guys can hold 4 to 5 mils of food per 100 grams. So when you're feeding them, the reason we recommend multiple small feedings is you don't want to exceed this amount per feeding, because then they have a high chance of regurgitation or vomiting. Okay. So here's a picture of a kitten. So basically you kind of tilt their head up, feed the tube in, and go. And when you first do this, you're like, oh my gosh, I'm really scared. What if I end up in the lungs? But it's like so easy. When you do it once, you're like, oh, that was really easy. And it's not a problem from then on. And we were doing it with the puppy over the weekend at school, and I kept telling the students, hey, remember everybody, like laymen, breeders do this all the time. So if they're comfortable doing it, we can do it too. We're veterinary professionals. That's what I kept telling them. So it's really very easy. It's not a big problem at all. It's just a matter of doing it the first time. So the orogastric tube you're going to remove after each feeding. The nasogastric tube, which is through the nose into the stomach, you can leave it in all the time. You don't have to keep taking it out. So it's a little bit more permanent, and it allows for continuous feeding. And there isn't a risk of aspiration, because it's permanently through the nose into the stomach. You're done. You don't keep taking it in and out, so they should not and you're sure you're in the right spot when you're done, so you shouldn't have a problem with aspiration. Typically, we're limited to a 3.5 French red rubber tube, and because that's how small the kittens are. If that does not fit in the kitten's nostril, it's not going to work. You're going to have to do orogastric because just physically we don't have a tube that's smaller than that. But 3.5 French is pretty small, and so you can usually get that into most of the little guys into their nostrils. Obviously, they're not going to breathe through that nostril, though, because you're going to occlude the airway. And so when you put it in, it's going into the cat's nose, just like this would show, and you're in place. So when you place it, you're going to measure tip of the nose to the last rib and mark the tube. So last rib is always where your stomach should be, and this time we're going from the tip of the nose. And then you're going to put some lidocaine into the nostril and just do a very little bit in little guys. They don't need a lot. 1 drop is all they're going to need. You can also just put a little bit of lidocaine jelly on the tube in lieu of putting it in the nostril. And then you're going to feed the tube through the nostril to the mark that you made on the tube. And so instead of just automatically kind of tipping their head up, like to put an orogastric tube, you actually want to put their nose down a little bit to start, and then once you think the tube is in the back of the throat, then lift their head up, and that allows kind of the epiglottis to fall down, and then you can feed the tube into the esophagus and down to the stomach. And then once it's in place, you suture it. So I have a video showing this. And one of the reasons that I'm sorry, one more thing. You radiograph it at the end because you always want to make sure, because this tube is going to stay in place, that it's where you think that it is. But again, if they're crying around it, not coughing when you give them food, you're in business. You can also aspirate through one of these tubes, and if you get stomach contents, you're in business. But to be safe, we always recommend a quick radiograph also. Okay, so the reason I want to show this particular video, which is, yes, it's us with an iPhone in ICU a while ago taking this video. The reason I wanted to show this was this is a student placing this tube. It is a dog, but this is a student placing a nasogastric tube. It's the first time she's ever done it, and she got it in no problem. So I wanted to show you that even if you don't know what you're doing, you can go ahead and do this right away. So we have someone holding the nose, and the dog's head is kind of pointed up toward the camera, and she's feeding the tube down the left nostril. And so she had already pre-measured and pre-marked. And what she did was she just went ahead and started feeding into that nostril, and it just kind of dropped right into place. This dog is not sedated, nothing like that. He's just sitting there. We do have a muzzle on because he was a little nippy. The neonatal kittens are not going to be, you won't need to muzzle them or anything. They're just probably going to sit there and lay there for you. So she's got ahead, and there's a black mark on the tube right beneath her finger where she's fed it into. So now what I'm doing is, this is a kind of a fancy tube that you wouldn't probably use for a neonatal kitten because it's pretty big, but it has a stylet in it to make it a little bit firmer. So I'm just putting a little bit of saline in or water in, and I'm pulling out the stylet. So the tube is now ready to go for feeding, and I'm capping it off right there. You would just go ahead and use a red rubber tube, which is naturally a little bit stiffer than these yellow catheters, and just feed it right in the way that I said. So once you're in place, you just have someone hold the tube so it doesn't come flying back out, and then you're going to go ahead, and I would recommend suturing these in place. Don't glue them because all it does is rip the skin off of the side of their face, and that's really painful when you go to remove it. So just go ahead and suture it, and that I'm just pointing right there where she's going to put her first suture. So she's going to go ahead in a second and place just a hypodermic needle. This one happens to be 20 gauge through the skin right next to the nostril, and she's going to poke on through. And then she's going to go ahead, and surprisingly that doesn't hurt at all. It's like a piercing. The animal will respond just at one instant to the first little prick, and then they're not going to care that it's in there at all. And then she's getting suture in her hand right now off. We just have some suture that's on a reel, and she's getting a piece of it. And she's going to come and go ahead and feed the suture through the needle. And go ahead and I'll show you where you place the first suture. In a second, she should be coming any moment here. Here she comes. So she's getting some suture, and I'm telling her what to do. So she's getting the suture. The dog is just hanging out, and the cat would do the same thing. And I'm telling her, don't feed the suture through the back side of the needle. Go to the skinny part of the needle because it's a lot easier to get the suture in. So she's feeding it in. Simple, simple. And then she's going to pull the needle out and leave the suture behind. And so again, vet student, they never did this before. No problem so far. Everything's going really, really smoothly. She's pulling out the needle, and she just has a suture. And then she's going to go ahead, and there's a little bit of bleeding, which we're going to blot in a second. And then she's going to go ahead and tie a knot. And so I would always recommend tying a 3 to 4 throw knot to the skin before you do anything else. And you can pre-place this suture before you put the tube in if you want to. So when you tie this knot, sorry, it'll get back on the camera in a second. When you tie this knot, it's going to basically anchor the suture to that area so that it will never tighten any further to the skin. So you can go ahead and tie it just a nice snug knot that's not too tight, leave it as is, and then you can go ahead and tie to the tube as tight as you want, and it will never tighten any tighter to the skin of the animal. So she's going to go ahead and do 4 throws that are just kind of a nice, comfortable amount of tightness to the animal. And then his skin is happy. We don't worry about necrosing it, anything of that nature. And then she'll start tying to the tube in a second. And this is just normal, good old 4 throws with the hand tie. And again, if this vet student can do it, anybody can. No big deal. You can also use an instrument to tie if you want to. So she's doing 1 more throw, and then she's going to start a Chinese finger trap. And I'll just let you see one of those throws, and then we'll move on because I think everybody knows how to do that. So it's same thing. Everything's in smaller scale with the kitten, but it's the same exact idea. Okay, so now she's going to put her suture on the other side of the tube. We're making sure the tube is at the black mark that we put with a Sharpie. And then she's going to go ahead and start tying to the patient. And now she can tighten this suture as tight as she wants because it's going to it's not going to tighten to the patient any further, so we should be in great shape. Okay, and so there she is. She's got a couple of throws, and we're in business. Okay, great. So I'm going to go ahead and click off of this. It goes on for quite a bit longer with her doing a Chinese finger trap technique. I think we could all figure it out once we kind of see where the suture goes the first place. And you can anchor a couple more sutures to like somewhere on the cat's head, just so the tube is not like flopping around their face. I usually put a suture on the top of their nose and then on the top of their head also, just to hold it in place and keep it out of the way. But you can do whatever you want with that. The one by the nose is the critical suture for holding the tube in place. Okay, so now I'm going to click off of this, and we're going to move on to a couple more things about feeding. Okay, so how much to feed when you do get a tube in place? All right, so caloric requirements are going to vary, but generally from 1 to 3 days old, they get 15 kilocalories per 100 gram of body weight. And then when they're greater than 6 days old, they go to 20 to 25 kilocalories per 100 gram of body weight. And between 3 and 6 days, you kind of make your best guess, somewhere in between. And if you want to feed them water separately, it's 13 to 22 mils per 100 grams of body weight. But if you're feeding a liquid milk replacer, the food and water stuff kind of goes together. And so if you're looking at what the manufacturer recommends, you're probably going to be able to do the appropriate amount. Okay, so let's see. In general, it's going to be 10 to 15% of their body weight is milk replacer for the first week. 20 to 25% of their body weight is milk replacer from the first week to the 4th week. And then you're going to monitor their body weight daily and feed them more or less depending on whether the animal is growing or not growing. And generally you feed every 2 to 4 hours if you're going to be doing an orogastric tube, or you can feed continuously through an NG tube. You can do intermittent feeding with the NG tube, but I usually just feed continuously and put the food on a pump that I can just go ahead. You can just use an IV fluid pump. You just use an empty IV bag and just pour a little bit of replacer in there. You only want to put about 4 to 6 hours worth of food out at air temperature at any one point so it doesn't get rotten as the day goes on. But I just usually just do that and continuously feed them. You can also use a syringe pump also. But remember, if you are doing intermittent feeding, no more than 4 to 5 mils per 100 grams of body weight, because that's their stomach capacity, so just don't exceed that. That's the one big thing.